Okay, so this is Leo. Leo is 5 years old and he got admitted today with pneumonia. And we have come in to check on our patient and we're noticing that he is not quite as active as he was on admission. He's really just kind of lying there. We have his pulse ox hooked up and his sats are starting to drop. He was in the mid-90s, now we're hitting 88, 89%, and his respiratory rate is really starting to slow down. So he is having intermittent gasping breaths. So we feel like Leo is showing signs of not only respiratory distress, but impending respiratory failure. So we have to act fast for Leo. So we're gonna start by pulling out our bag mask. And this is a self-inflating bag, which means that you don't have to have it hooked up to an oxygen source to give active breaths with our pediatric face mask. Important points about the face mask: it should be the right size, meaning it's going to fit over the mouth and the nose, but not cover the eyes, so that we can get a good seal. And when we hold our mask, we're going to try to get towards the head of the bed, which either means if you have a bigger patient in a bed, you can easily get to the head of the bed. If you have a smaller baby, like in a crib, you might have to turn them sideways. Or if there's time and space available, you can pull them out of the crib and put them on an adult bed in the room so that you can get at the head of the bed, so that you can get their head and neck in the sniffing position, which basically means their nose is going to be kind of pointed straight up, head and neck aligned. Then you're going to put that mask over the nose and the mouth, and you're going to have your C and E hold, which basically means that your thumb and first finger are going to make a C around the mask, and your 3 leftover fingers are going to kind of make an E down here towards your jaw so that you can hold that airway open. And then you're going to start giving breaths. And per PALS, in pediatrics, we give breaths 1 for every 3 to 5 seconds. But it's pretty easy to remember 1 and 2 and 3 and breathe, just like we do in NRP. Has a nice rhythm to it when you start giving your breaths. You're going to give a breath until you start to see the chest rise for about 1 second. If you're not seeing chest rise, or you can feel that air coming out of the mask, you're going to adjust your mask so that you start to see that chest rise. And then you're going to give 1 and 2 and 3 and breathe, 1 and 2 and 3 and breathe. So if you have come upon a patient who is in respiratory failure, is not breathing, you want to give breaths right away and then call for your backup, your trusty help, so that you can get other things going like cardiac leads on, making sure the pulse ox is on if it wasn't already. If your sats are not where we want them to be, you're going to want to hook up to oxygen. So we're going to hook that up to the wall, turn it all the way up to 15 liters. Now we have free-flowing oxygen added to our breaths. And then the next thing that you're going to want to check is a pulse, so that we know if we need to start acting for cardiac function as well, or if this is still all respiratory problem. So you're going to check heart rate, and 60 is your magic number. If your heart rate is above 60, you're just going to keep doing your 1 breath every 3 seconds while calling your trusty Peds backup to come and help with your patient. Other important things about the bag, it's important to not hyperventilate in rate or volume. So again, you just want to start giving a breath until you see the chest begin to rise. And then we all get very excited when dramatic things start happening with our kids. So if you are in charge of bagging and the airway, that really needs to be your sole focus. So you need to get help in the room so that other people can take care of other things. What we typically do is get really excited and then we start breathing like this. Nobody breathes that fast, or we get sidetracked thinking about something else and we forget to breathe for the patient. You have now become the patient's lungs. So if you are doing the breaths, you really have to focus on what you're doing so that you can adequately give your patient what they need. If bagging becomes very difficult, that sometimes can be a clue that something else is going on. So thinking about pneumothorax, seeing about needing chest x-ray or other testing would be indicated.